Thanks very much for inviting me to provide a few brief opening remarks, and I'd very much like to welcome our distinguished guests from Brazil, Costa Rica, Uruguay, visitors from other organizations, and World Bank colleagues. This really promises to be an incredibly exciting workshop on a topic that is very topical. The sustainability of health expenditures is really a crucial issue. And advancing this agenda really does, I think, require collaboration, information sharing, learning from others. And so the work that takes place within this network and within this workshop, I think, is incredibly important. In fact, last week, I was at an event, an annual meeting of the senior budget officers of the OECD countries. And one of the issues that was being discussed there really was also sustainability of healthcare expenditures. And there was actually an agreement to form a joint network looking at financial sustainability of health systems that would bring together senior budget officers and the OECD Health Committee. I think there was a growing recognition that improved dialogue and concerted actions are really needed between ministries of finance, health care practitioners and ministries and other partners to be able to develop sustainable systems and for each partner to actually understand the points of views and perspectives from the others. There was full support from senior budget officers for such an endeavor, and really a recognition that there was a need to find win-win solutions. That this isn't one person, Ministry of Finance says we're not able to actually finance something, and the health agency says what we really need to, but really a need for actors to come together and find win-win solutions. So there was full support for moving forward on that agenda. I think particularly in these countries where you have universal access enshrined in the Constitution, having those conversations around how do you then actually define a sustainable health care system that provides adequate services for the poor and vulnerable as well is an incredibly important issue for countries to be addressing. And many countries are really quite some distance from having this in place. I think work at both the policy and legislative arena on this front is very important, and a point I want to underscore. But that said, when citizens are denied services where they actually have been provided basic rights, we're now seeing, as was mentioned in many countries, that judicial interventions are actually becoming increasingly common in terms of actually providing these access to services. There hasn't been too much research done in this area, although there has been some done recently by the bank, and I think you'll hear more about that later today, that starts to look at what is the actual impact of the use of judicial interventions to bring forward basic rights. And I think one of the things that was found in a recent study of 5 countries was that, in fact, the results of litigation have been a bit more positive than was expected for lower income people. But I think there's still much to be learned in terms of what are the appropriate and best institutional arrangements for particular country circumstances. I think there are a wide range of issues that are open for discussion and exploration. Some of these will be a topic for conversation today. Some of them may be outside the scope of this workshop, but are ones that I hope collectively we begin to think through going forward. I think first and foremost, and perhaps not so much a conversation today, but something that was alluded to earlier, is a question of how do we actually define universal health care, but in a way that is actually sustainable. This is an important issue that every country will need to grapple with within their own particular country context. Second, what are the most appropriate institutional arrangements that can be put in place in individual country circumstances, from the financing side, from the service delivery side, and then the role that the judiciary can actually play in enforcing those arrangements. Third, when we are in a situation where there are judicial rulings, what are the factors that actually influence whether or not there's actually compliance with rulings once they're made? Another issue for consideration: should there be mechanisms or not that could curtail the court's power to issue decisions that might imperil fiscal sustainability? Fifth, how can ministries of finance quantify the contingent liabilities that may arise from legal claims and adequately start to address those in the budgeting process? And finally, what pressures can be brought to bear through a variety of mechanisms, including perhaps through judicial rulings? What pressures can be brought to bear for change within ministries of finance, within social services and health institutions, to develop strategies that can address weaknesses, financial weaknesses, that currently exist in many of these institutions? This is quite a huge agenda. I'm really excited that WBI has taken the lead in partnership with Menis to try to create a platform to surface a discussion around these issues and to provide a mechanism for helping to learn from each other as to how countries are trying to deal with these issues. I think this workshop is extremely timely. I'm very much hopeful that the discussions will be very fruitful and will push forward the agenda. And I look forward to talking with the organizers later about the outturns of the event and what we've actually learned from that. So with that, I wish you all a successful day. You're very lucky you're in the new World Bank building here, so you actually get to see outside. If you were in our headquarters, you'd be squirreled around in a basement. But I hope the little bit of daylight will also help make the discussion lively and an enjoyable day. So good luck.